Hello and warm welcome to Cardiac Arrhythmias. This is module 1 of making a diagnosis series. 5 rhythm strips about 5 cardiac arrhythmias are presented, each with 4 options to choose the correct one from. The first question is about a bradycardia. There are 4 options. Choose the correct one. A regular rhythm is disturbed by an early beat. What is the cause of the early beat from this list of options? 2 pauses disturb a bradycardia. There are 4 options to choose the correct answer from. 2 QRS complexes are followed by a pause in a recurring pattern. This is called bigeminal rhythm. What is the cause of this arrhythmia? And finally, a regular rhythm at a normal rate is presented with 4 options to choose from. I would like you to pause the video here and answer the questions. These are the answers. Let's start analyzing the ECGs and find the method to diagnose an arrhythmia. Question number 1. This slide shows a bradycardia. We can confirm bradycardia by mapping the QRS complexes. Interval between each QRS complex is called R2R interval, which in this case is 2000 milliseconds and heart rate is 30 beats per minute. Obvious P waves are mapped and a caliper to measure P2P interval is used backwards and forwards to establish the atrial rhythm. Atrial rhythm is mapped out to be regular at P2P interval of 700 milliseconds, giving an atrial rate of 85 beats per minute. Regular atrial rhythm rules out option D. There are 3 P waves per each QRS complex. This rules out 2 to 1 AV block as the cause of bradycardia. We are now left with complete heart block and 3 to 1 AV block. If this is 3 to 1 AV block, there should be a fixed relationship between atrium and the ventricle. If we measure the PR interval of the first complex and the last complex, in this regular rhythm, they are of different duration. There is AV dissociation and the diagnosis is complete heart block. Option A is the correct answer. Question number 2. A regular rhythm with narrow QRS complex is disturbed by an early beat, which is again narrow, ruling out ventricular premature beat as the cause of early beat. Each QRS complex is preceded by a P wave at a fixed PR interval. There is no AV dissociation. Mapping midway between 2 obvious P waves, there is a non-conducted P wave. Atrial rhythm is regular at around 100 beats per minute, with every other P wave failing to conduct to the ventricles. This is 2 to 1 AV block. Early beat is due to conduction of 2 consecutive P waves during 2 to 1 AV block, followed by a blocked P wave. During 2 to 1 AV block, conduction of 2 P waves and a 3 to 2 AV block is better AV conduction, interrupting upward. Option D is the correct answer. Question number 3. 2 pauses are documented in this rhythm strip. P waves can be mapped, and using a P2P interval caliper, we can go forward and backward to identify atrial rhythm to be regular at a rate of 110 beats per minute. Regular atrial rhythm rules out option B. Similarly, the rhythm is regular and sustained throughout the rhythm strip, which rules out option D, concealed conduction of non-sustained atrial tachycardia. All QRS complexes during the regular rhythm are preceded by a P wave with fixed PR interval. Every other P wave fails to conduct to the ventricles. 2 to 1 AV block is the cause of bradycardia. 2 consecutive P waves fail to conduct, followed by a conducted beat. This is 3 to 1 AV block. Question is whether this is type 1 or type 2 second degree AV block. If more than single P wave is dropped, this is a characteristic of type 2 AV block. PR interval is fixed throughout the rhythm strip. Wide QRS complexes are seen in type 2 AV block as this represents a disease in the His preconscious system. If we measure the duration of pause and that of 3 P2P intervals, pause duration equals 3 P2P intervals. This rhythm strip which shows pauses is because of type 2 second degree AV block. Option C is the correct answer. Question number 4. Long cycles are followed by short cycles. This is called cycle length alternance. Every QRS complex is preceded by a P wave at a fixed PR interval. A P wave appears much earlier than expected and fails to conduct to the ventricle, leading to the pause. Mapping the atrial rhythm shows two sinus P waves followed by an atrial premature beat and a pause. This leads to an irregular atrial rhythm. In AV blocks, atrial rhythm should be regular with rates less than 100 beats per minute. In sinoatrial exit block, there are no P waves during a pause. Sinus P wave is followed by an atrial premature beats in atrial Bigeminal, while in this example there are two sinus P waves followed by an atrial premature beat, a condition called atrial trigeminy. Non-conduction of atrial trigeminy is the correct answer. Question number 5. A regular rhythm at a normal rate is noted. Wide QRS complexes in the early part of the rhythm strip are preceded by a pacing artifact. These are ventricular paced beats. This rules out left bundle branch block as the cause of wide QRS complex. Every QRS complex is preceded by a P wave at a fixed AV interval. P waves are sensed and ventricle is paced. This is called A-sense V-pace rhythm. This rules out VVI pacemaker in which there is AV dissociation. An early beat disturbs the regular rhythm and this is because of atrial premature beat. It resets the sinus rhythm, allowing the atrial pacing artifact to appear and capture the atria. This complex is atrial paced ventricular paced rhythm. This differentiates it from VDD pacemaker which has no capacity to pace the atria. The change in morphology of this beat from previous and the next beat is because it is a fusion beat between paced and conducted beats. This is DDD mode of pacing and option D is the correct answer. So in this module of cardiac arrhythmia, making a diagnosis, we made the diagnosis of a complete heart block out of these four causes of bradycardia. Multiple causes of early beats were assessed to reach better AV conduction, interrupting a poor one as the diagnosis for early beats. The pause was analyzed to be due to type 2 second degree AV block, and bigeminal rhythm was because of non-conducted atrial bigeminal. Regular rhythm at a normal rate was because of sinus rhythm in DDD mode. Thank you for your attention.